Please.
We have a question to Ms. Mara. We'd like to ask you about the diet. What kind of diet you implement for children with autism? And do you have any statistics between the children who have diet and who do not have diet in improving?
Hi, thank you for the question, because I think I may not have left it clear. We don't give any kind of diet to the children.
But in your presentation with diet.
We receive many children that come to our program with many restricted diets, sometimes crazy diets, sometimes very complicated. So we always send them to the nutritionist. We try to make to rationalize what they are doing. We want to assess if they are getting into any nutrition deficiency. We discuss with the family the evidence on the diets, which is none. And only in a few cases when people really want to try a gluten and casein diet because they have been told so, and we see that there are some gastrointestinal, even functional symptoms, then we inform them how they should do it and what care they should have. But what we mainly do is to get rid of restricted diets, to get rid of all supplementary kind of treatments that they are taking, most of them alternative treatments without any evidence, especially the dangerous ones, for instance, Kellans and those. So we explain them what they're doing, what are the risks of that, and if they may be in any risk. So it's more like making rational approaches to that than giving diets.
You mentioned virtual reality training programs for safety. I wonder if you could tell more about that.
Yes. The beauty, there's a number actually. That book I mentioned, there's a whole chapter on safety and there's some references. And so if you find that safety chapter or if you email me, I can email you the references. But the idea of virtual reality is an interesting one in the sense of you can make it exactly the same over and over again. You can make it, I think one of the reasons also why games and virtual reality things are somewhat appealing to children with autism is that it's not a horribly complicated world. And so that you can minimize kind of the distractions and focus on the things that are most relevant. And then you can make it increasingly lifelike, and then you can start to introduce change. So it has on the face of it a number of things. There's been a couple developed. The one that I know the best is one that has to do with crossing the street. That's a common area for children to get hurt. The other, there's some unpublished data which I've seen about accidents in children with autism. The most common time children have accidental injuries are at times of transition, not surprisingly. So it's that insistence on sameness trouble is when the child is acting out and may bolt into the street. Or I've had children jump in front of trains or jump out of cars in the middle of the turnpike. And sometimes it's out of the clear blue, but it's often in the context of some change, often with an unfamiliar caretaker, sometimes sadly with familiar caretakers too. But the safety business is not to be underestimated.
I have a question, or maybe more of a comment for Dr. Mills. You mentioned about frequent drinking. Has the question of frequent urination come up as well? Because that's a problem that I personally have with my son, and I imagine lots of parents have mentioned that, because obviously the two go hand in hand.
Yes, they do. We didn't actually. Yes, they do go hand in hand. We don't have any data on the frequent urination. We only collected data on the drinking, I'm afraid. But anecdotally, there are accounts of frequent urination and inappropriate urination.
Some other question? No.
Sorry.
Thank you. Maybe a question to Dr. Volkmar. Can you say something about, briefly remind us about the mechanism of action of this risperidone and the indications, counterindications, and benefits and risks and so on?
The short version of a long story. Risperidone is what's called an atypical antipsychotic. It's different in terms of this whole group of medicines has what is thought to be a better side effect profile in terms of some of the movement problems that we were so worried about with the first generation of antipsychotics. They target some of the serotonin as well as some of the dopamine receptors in the brain. They actually, I think now have been 2 officially approved in the United States. There's risperidone and I don't remember whether Abilify, but the side effects are often the problem. With risperidone, there's also a direct stimulation of appetite, and so these are sometimes cause children to gain weight. And this is a population that's already somewhat sedentary, prone to obesity, and so that can be a problem. They don't always lose the weight. It's not always there, but it can be a problem. That being said, in that double-blind study, which was across 5 sites, there were significant behavioral differences by 2 weeks of treatment, and the measures had to do with agitation, upset, aggression. It really led to a prompt improvement. And the interesting and encouraging thing was that medicine could be tapered, and often the benefits remained. There's some newer work going on right now looking at risperidone in combination with behavioral interventions to see if the two together could potentially be even more effective. And there are a number of other agents that are being very actively looked at. So it's a promising area. Like everything else, you always have to weigh the pros and cons of the drug treatment.
Vorrei chiedere al professor Volkmar rispetto agli adulti che raggiungono l'autosufficienza, che dati avete negli Stati Uniti sulla misura dell'autosufficienza, per esempio in che contesti, urbani piuttosto che non urbani, con che tipo di supporti educativi, con che intensità? Allora, rispetto agli adulti che raggiungono l'autosufficienza.
I got it. Thank you. It's interesting. The American system is complicated and crazy, but the beauty is, we have states and federal, and so we have 2 kinds of government. The federal law, starting back with Public Law 94-142 back in 1974, really applied to the whole country. Now, that being said, the interesting thing is there are tremendous variations from state to state in how the law is implemented. So there are some states, like North Carolina, that have wonderful statewide programs and have for years and years and years. Delaware is another such state. Other states, like mine, it's a very small state, but it has many private schools for children with autism. Within a 25-mile radius of New Haven, there are 4 or 5 special needs schools catering to children with different needs. So it's a very interesting sort of hodgepodge of basically many different intervention models going on. That being said, the data that I've seen has mostly it really has not looked at rural versus urban. I can tell you that often the rural services are not nearly as extensive. That being said, it's interesting that there have been some models in various states where there are pretty reasonable urban services. So I think we're seeing more and more children really around the country do better. And I think it's partly the mandate for early services that people, even if they have to think about it, not necessarily having the best program, at least it's crossed their mind. I went out and visited, I don't know how people would translate this, but there's a group in the States called the Amish who live sort of back in the 1800s, 1700s, horses and buggies. They have children with autism. Their children go to school, but they want services for their children that are in accord with their faith. And so it's a very interesting sort of set of many different experiments going on. There are, I think, also the other thing to know on the computer network, there's a nice program, it costs money, but it's a nice program called Rethink Autism. I think it's rethinkautism.com. I'm on their professional board, but I don't get paid a cent for it. But it's a way you can go online, collect data, put the data online, There's lectures online, behavior mod, ABA type lectures, so that there are more and more resources, and we need more and more of that, especially I think to help in rural areas where getting services can be really such a horrible problem.
Another question? There. All right.
Yes, a question for Dr. Volkmar about research into sensory integration and about the special diets as well, about their effectiveness.
The question is how much the evidence body? Some, but not much. There's going to be a book from Springer next month on evidence-based treatment in autism, and there's a whole chapter on both of these. There's a little bit, but not much. One of the problems, in contrast, I think, to there's no question there are sensory issues. There's no question there's feeding issues, as you've heard. The problem is that much of the research has been done in fields like psychology and medicine, where there's a big push to do research. In fields like occupational therapy and nutrition, there's some research, but there's not as much, and it's not as much quality and quantity. So there's a little bit, and if you're interested, I can send you some references. As much as possible in that parent book, we actually tried to cite references to available research. And so there's some, but I've got to say it's really, I wish there were a lot more.
So is there enough to be able to draw a preliminary conclusion for?
I think from the practical point of view, for teachers in school, there's research that's based, for example, on single cases. Now, again, I'm talking about peer-reviewed published research in reputable journals. When you get into what's the broader knowledge base, people, for example, on the internet will make these amazing claims, or they'll have these very sort of interesting theoretical models, but the models tend to be somewhat diffuse. So it'll say, well, there's a brain, and the mind is connected to the brain. It's connected through the nerves. And you're saying, yeah, but, where's the beef? What's going on here? And so that's one of the dilemmas with, for parents going online, as you see all these claims. The published studies, there are some. They show some effectiveness for some of the OT interventions, things like the weighted vests. One of my other hats is editor of the Journal of Autism, and I'm really trying to encourage papers that look at some of these interventions, even papers that have negative findings. That's another funny problem in this area. It's harder to publish a paper where you don't get good results. But of course, in just this area, that may be important for people to know so that they can see, and then you can criticize the paper and do other things. But I'd be happy to send you some references to what is there.
Thank you.